right, when you think of people who are sleep deprived, you probably think of medical residents, maybe shift workers, but mothers of newborns are often some of the most sleep starved among us. And now a new study shows it's not just sleep deprivation, but the fragmented sleep they're getting that can have long-ranging effects on their health and actually how they function during the day. Dr. Joseph Ogile is here from the Clayton Sleep Institute. Thanks so much for coming down to shed some light on this. The study seems to show that mothers of newborns aren't just sleep deprived, but they're actually, this lack of sleep is leaving them impaired during the day, unable to really function. How impaired are they?
Well, what's interesting, Kate, that for the first time, we've looked at their time of sleep, the fragmentation, and also their ability to perform an actual task. So there's testing that was done on these moms for weeks after they delivered their children to see how they could function, how they could respond to stimuli, testing, and respond to that in an appropriate way. And they were significantly impaired, not quite to the level of, say, intoxication, but significantly impaired to tasks that they should normally be able to do. And this impairment, at the end of this trial period, still had not recovered to a level that would have been normal for a normal person. And that it leaves us wondering, at what point do these new moms begin to get their ability to function normally returning?
Right, and these are moms that are going back to work. They're driving their children or child around in a car when they probably maybe shouldn't be.
Well, they're certainly having difficulty compared to how they were before they had their children, and it's unclear what the reasoning or the etiology, as we would call it, that they would still have this impairment, because they're getting more sleep, they're getting enough hours of sleep during this phase. You saw the graphs in the article, and yet they're still remaining impaired.
That, I think, was the most startling thing to me, is that these moms, over the course of the 12 weeks they were followed, were getting more sleep by the end of that period, but it was the lag time that was still leaving them unable to really function well because of the past sleep that they missed.
And so
it's scary.
It is scary, and we don't know if it's as you use the term lag, the lag from the last trimester being so sleep disruptive, or the initial period after pregnancy. But it doesn't appear that it's related, based on the initial impression, to the child care needs. There's something else, it appears, biological, that's still going on. The unfortunate thing for us, and it's not a criticism of the study at all, it was just a limitation, is, to everyone's surprise, it didn't show us the trough. We didn't see that where the moms are going to get better. So we don't know how to advise patients yet. There needs to be more work to look at this.
I was going to ask you, what should moms do? That's the big question. Just be careful.
Be careful. I think as families, we have to be sensitive to the fact that the moms are impaired, because there are times when moms are talking about these issues, and maybe we aren't listening as well as we should be to their complaints, because based on this data, they're quite real, and it's measurable. This is actually measurable data of impairment, not subjective data where somebody says, oh, I don't think I'm functioning up to norm. This now is actually measured, so we can look at that, measure it, touch it. It's a serious concern, I think, for moms going forward. We need to be aware of it.
Important finding. Dr. Joseph Ogile from the Clayton Sleep Institute, thanks so much for joining us.